Hi, everyone. I wanted to take the time and just reflect on my journey throughout this course. We're in week 10, and I wanted to just share, the 10 weeks, about my clinical experience and my growth. Wanted to just revisit my goals from the beginning and through the last 10 weeks. And, my primary goal was to enhance my self-awareness, particularly in understanding how my emotions, biases, and responses impact, that therapeutic relationship that I form with my patients. Another goal was to improve my ability to manage these emotions effectively, ensuring they don't interfere with patient care. Looking back, I believe I have made significant progress toward these goals, though, it's been challenging and enlightening, changing gears just from being, the bedside nurse to going to be that provider, taking on that different role, having a different framework or different outlook on things. So throughout this experience, the clinical experience, I encountered moments where my feelings, prejudices, and biases, surfaced. For instance, I found myself feeling frustrated with patients who were non-compliant with their treatment plans. Initially, the frustration stemmed from, my strong sense of responsibility to ensure patients receive that optimal care. But I quickly realized, that these feelings could potentially harm that therapeutic relationship. To manage these emotions, I employed reflective, practice techniques such as, journaling, discussing these experiences with my supervisor, or, currently where I work, or my preceptor. This helped me to step back, analyze my reactions, understand the underlying triggers, allowing me to approach these situations with more empathy, with more patience. Managing the anxiety, the self-doubt, the uncertainty was another significant aspect of my journey. There were times, especially when dealing with complex cases, where I felt unsure of my decisions. In these moments, I turned to reflective practice to process my thoughts and emotions. By breaking down my experiences and identifying what specifically caused my anxiety, I was able to develop coping strategies, such as breathing exercises and seeking feedback from more experienced colleagues, which helped me build confidence in my clinical skills. The colleagues like other nurse practitioners that I currently work with, the psychiatrists that I currently work with. One of the most profound insights I gained, during this experience is the importance of self-awareness in clinical practice. I realized that my strengths, such as my commitment to my patient care and my ability to connect with the patients on an emotional level, can sometimes become limitations if not managed properly. For example, my deep empathy for patients can occasionally lead to emotional exhaustion. However, by recognizing this and setting boundaries, I've learned to use strengths more effectively while also protecting my well-being. Reflective practice has significantly impacted me as a person, student, and future provider. It has allowed me to develop a deeper understanding of myself and my interactions with others, which has, been valuable in my growth as a psychiatrist, nurse, provider, practitioner, student. Moving forward, I plan continue to use reflective practice in my professional life. I believe that an ongoing reflection is essential for personal and professional growth, as it helps me to stay attuned to my emotions, manage stress effectively, and continually improve the care I provide to my patients. In conclusion, this course in clinical experience have been transformative, not just in the terms of, the skills I've acquired, but in how I view myself and my role as a provider. I'm grateful for the opportunity to grow in self-awareness and for my tools I've gained to manage the challenges that I've come with this profession. Thank you.